Have you been avoiding cheese because you think it raises cholesterol and increases your risk of heart attack? What if I told you that certain types of cheese could actually help clean your arteries, reduce inflammation, and protect your heart? Would you want to know which ones? Millions of people over 50 still believe that cheese is a major cause of stroke and heart disease. But is that the whole truth? And if there are cheeses that actually help prevent plaque buildup, could you be cutting them out of your diet without realizing it? In this video, I'll show you which types of cheese you should eat and which ones to avoid, along with the latest medical evidence on fats, calcium, and vitamin K2 in cheese, and how they truly impact your risk of heart attack and stroke. Most importantly, I'll guide you on how to eat cheese the right way to support your heart health without raising your bad cholesterol. So, where's the line between a food that protects your arteries and one that could stop your heart? Last week, a 62-year-old man came in for a consultation and told me he had completely eliminated cheese from his diet for over a year. He had a history of high blood pressure and was advised by his doctor to avoid saturated fat, especially from cheese. But after 12 months, his cholesterol levels hadn't changed much. They were still high, and he felt more fatigued, had lost muscle mass, and no longer enjoyed his meals. He asked me whether cutting out cheese had actually improved his heart health. The answer isn't as simple as he thought. For years, saturated fat has been blamed as the main cause of clogged arteries and heart attacks. But research over the past decade has shown that the type of fat, source of food, and how your body processes it matter far more than the total amount of fat you eat. Cheese is not the same as fried meat or processed junk food. Certain types of cheese are rich in probiotics, contain high-quality bioactive proteins, and are an excellent source of vitamin K2, nutrients that can have a positive effect on vascular health when consumed properly and in moderation. Vitamin K2, especially the form found in naturally fermented cheeses like Gouda or Parmesan, has been shown to help direct calcium away from artery walls and back into your bones. This reduces the risk of arterial calcification, a key factor in stroke and heart attacks among older adults. Without enough vitamin K2, calcium tends to deposit where it shouldn't, forming hard plaques inside blood vessels, restricting blood flow and raising blood pressure. On the other hand, if you consume processed cheese loaded with sodium, preservatives, industrial oils, and artificial additives, you're not only taking in excessive salt, but you're also introducing harmful substances that can damage the endothelial lining of your blood vessels. This inner lining is essential for protecting your arteries and maintaining their elasticity. Once it becomes inflamed or compromised, your risk of plaque buildup and blood clots rapidly. I told my patient that the real issue isn't whether you eat cheese or not, it's what kind of cheese you eat, what you eat it with, and how often you eat it. When we approach nutrition with a more complete perspective, we can better identify which factors support health and which ones increase risk. If your goal is to protect your heart and blood vessels, start by choosing cheeses that offer biological benefits. The first one worth mentioning is Parmesan. This is a hard, aged cheese that's rich in protein and especially high in vitamin K2. It has a strong, savory flavor, so even a small amount can enhance the taste of your meal without adding excess fat or sodium. The second is Gouda, another naturally fermented cheese. It contains beneficial probiotics that support digestion and a significant amount of vitamin K2. Gouda has a soft texture, making it easier to slice and chew, ideal for older adults or anyone with difficulty chewing or swallowing. The third option is cottage cheese, particularly the low-sodium or no-salt-added versions. Cottage cheese is a light, easily digestible protein source that's low in fat and suitable for people managing high blood pressure or cholesterol. It works well as a breakfast option or mixed with vegetables, and it doesn't spike blood sugar or insulin levels as long as you avoid pairing it with white bread or refined foods. Just as important as the type of cheese is how you combine it. Many Americans eat cheese with white bread, French fries, deli meats, or sugary sauces. This combination is what turns cheese into a cardiovascular burden. But when you pair cheese with leafy greens, raw nuts, extra virgin olive oil, or avocado, you're creating a balanced meal that supports blood sugar stability and reduces visceral fat storage.
Cheese should be treated as a small addition to a meal, not the main course. A reasonable portion is about 30 to 40 grams per serving, up to 3 times a week if you have a history of heart disease or high blood pressure. Be especially cautious with processed cheeses like packaged cheese slices, fried cheese sticks, or those made with vegetable oils and additives. These products are often high in sodium, industrial fats, and offer little to no biological value in terms of vitamin K2 or probiotics. When consumed regularly, these types of cheese can contribute to high blood pressure, increased inflammation, and a higher risk of arterial plaque buildup. Ultimately, heart health doesn't depend on a single food. It comes down to your overall lifestyle. If you choose the right kinds of cheese and combine them with a diet low in sugar and refined carbs, rich in leafy greens and healthy fats, you can continue to enjoy cheese without harming your heart. In fact, the right cheese can actually help you get essential nutrients, maintain muscle mass, improve bone density, and support better vascular function over time. If you're over 50, this is a critical time to reevaluate the way you eat, not just for your weight or cholesterol, but for the long-term health of your heart and brain over the next 10 to 20 years. Heart attacks and strokes often strike without warning, but your body sends earlier signs through elevated triglycerides, rising blood pressure, and silent inflammation in the arteries.
Cheese is not the enemy, nor is it a miracle cure. It's one small piece of your larger nutrition and lifestyle picture. If you choose the right kind, eat it in moderation, and avoid pairing it with refined carbs or heavily processed foods, you can use its nutritional benefits to help combat muscle loss, declining bone density, and vascular inflammation, all of which are key risk factors for heart attack and stroke. Start by reading food labels more carefully. Choose natural, fermented cheeses that are low in sodium. Stay away from industrially processed cheese products. Pair cheese with vegetables, nuts, and healthy fats. Keep up with regular physical activity, manage your blood pressure and blood sugar, and, if possible, get routine lab work to monitor total cholesterol, LDL, HDL, triglycerides, and inflammation markers like hsCRP. If you found this video helpful, please share it with your loved ones, especially parents, siblings, or friends who may be at higher risk for cardiovascular events. A small change in eating habits today can make a big difference in long-term heart health. And if you'd like me to create more videos on heart-friendly foods, how to understand your vascular test results, or how to design meals for people who have had a heart attack or stroke, leave a comment below. I'll prioritize the topics that matter most so you can live longer, stay stronger, and avoid unnecessary dependence on medication. Thank you for watching until the end. Heart health is your responsibility, and it starts with what you choose to eat every day. Make the right choices. Live well.